And here with answers to your medical questions in our Ask the Doc segment is Dr. Msonthi Levine. So this is a good idea if this actually comes to be true. A simple blood test preventing colorectal cancer?
I mean, there's so much blood out there. We check for everything. I think that was a similar program a couple of weeks ago. We talked about a different cancer and talking about a tumor marker. We have a few available, but we don't use them to screen. We can sometimes use them to diagnose and follow the patient. It is a novel idea, a neat idea, and hopefully in the future we can fine-tune it and have that available. But still, standard of care is to get a colonoscopy at the age of 50 and subsequent thereafter, depending on what they found on the original colonoscopy. If you have bad family history, you may need it a lot earlier. Certainly if you have symptoms like bleeding, weight loss, abdominal pain, chronic constipation, maybe you need it a lot sooner. So hopefully in the future we will have that blood test because it is less invasive, it is quick, it is easy. You don't have to drink the prep.
But I think that's what most people don't like, is the idea of having to drink the prep and just the, I guess, the thought of a colonoscopy.
Absolutely, we have to go through it, you know, rite of passage, so to speak, at the age of 50. So I haven't had one yet. I'm looking forward to it. No, I'm not. But yeah.
But it's not that bad. I mean, considering, look at the options.
Oh yeah, absolutely. That would be a great thing to do. I think it would increase the chances of patients being screened more often. You're absolutely right.
All right, on to some of our viewers' medical questions. Let's see here, going off of my phone. What could make someone pass out sometimes?
Oh, we call that syncope. A lot of times we think about low blood flow to the brain, so we concentrate a lot on the nervous system, cardiovascular system. It is very common. More as we get older, the more medications we're on. So they need a workup to figure that out.
Okay, another question. I tore my distal bicep tendon completely off of the bone. Sounds painful. My surgery is set for Wednesday. What kind of recovery time do you think this person is looking for such an injury?
This kind of depends. Certainly several weeks. If they are sick leading into it, they might have more problems. If they have complications after the surgery, that's going to prolong it, but ideally probably several weeks.
Okay. How does one help bunion pain?
A lot of times probably change the footwear, certainly get to a foot doctor, maybe have some surgery to correct the anatomical defect on the foot. So a lot of times you can live with that, but as it becomes more painful, that might need something more aggressive.
Okay. What causes you to crave sweets?
Probably just being in America and just advertising, and we all love sweets. You know, stress can do that. A lot of alcohol consumption can do that as well. I mean, it's okay to consume sweets, but overconsumption is the problem in America.
Okay. A 7-year-old boy with cystic fibrosis just recently started having seizures. What could cause this, and what's the best thing to do after a seizure when he's dazed and confused? And could this cause permanent damage?
Not necessarily unless he injures himself. Seizures typically are treated with medications. Certainly he needs a full evaluation. Trauma to the brain as well as anything can cause seizures in the brain. You don't have to have a reversible cause. You can't have it just all of a sudden. He certainly needs a workup if this is his first seizure. Bring him to the hospital, get some scans, and get him some medication.
Okay. This person is having an ankle surgery, tendon is tearing. What is the recovery time on that?
Again, anytime you talk about soft tissue injury like the ligaments or the tendons, you're talking about several weeks. Certainly maybe some surgery, some rehab. Trying not to use it because that can certainly make it a lot longer to recovery, and just kind of depends on the original injury as well.
So get on some crutches if you're trying to recover from this.
Listen to your doctor, get on some crutches, and make sure you're not re-injuring it over and over again.
All right, we've got lots of other questions. We'll get to those in just a minute, so don't go away. Dr. Levine will answer more of your questions next on Live at 5. We're back with Dr. Msonthi Levine to answer more of your medical questions. This is a 62-year-old woman. She's having pain in her right arm. Is the possibility there for it to be heart problems?
Typically not. It's going to be on the left side. I mean, heart disease can present very unusually, especially in females. So if this person has any risk factors, high blood pressure, diabetes, family history, tobacco abuse, that's something we would consider, but typically it's going to be on the left side.
Okay. How is a hiatal hernia usually treated?
Normally with medications. If you don't have any symptoms, we don't have to treat it at all, but typically acid reflux medications such as Prilosec, Pepcid, Tagamet can work really well. Normally if you fail the medical therapy, then surgery can be considered, especially if you're having a lot of nausea, vomiting, you're losing a lot of weight, the pain is severe.
Okay, a 63-year-old woman has a history of facial moles. Some are beginning to ooze clear liquid. Is this normal?
I guess it can be, but certainly probably unsightly, and skin cancer is always on the horizon, always on everyone's mind, so I probably would get that evaluated by a dermatologist, may need a biopsy.
Okay, a 45-year-old woman, do you ever get over a fatty liver?
Well, you can, because we think a fatty liver is related to weight gain, and as you know, a lot of Americans are suffering and struggling with that because of those sweets are always lurking around the corner. This is holiday weekend, holiday season, so a lot of overeating and under-exercising in America, so that contributes a lot to fatty liver. So bottom line, lose weight. That typically fixes the fatty liver. If it's not treated long-term, research is suggesting it can contribute to the development of liver cirrhosis, and that can develop liver cancer. So it is something that you need to be aware of.
Okay. This is a 54-year-old woman. She's got sharp pain in her upper back. What could it be?
A lot of times osteoarthritis or degenerative joint disease of the back is a problem. We see a lot more of that during the winter months. Can probably start off with some over-the-counter anti-inflammatory medicines such as Motrin and Advil. If it doesn't get better, we can do an x-ray or an MRI, maybe even some epidural injections. There's a patch called Lidoderm that works very well for those type of focal symptoms, as well as Neurontin and Lyrica work very well for that type of pain.
Okay. This person says, what causes abdomen pain so bad that it makes them want to vomit?
You know, there's so much in the abdomen that normally requires a big workup, normally some blood, CAT scans, maybe endoscopic evaluation. It could be liver, stomach, pancreas, gallbladder, you know, so many different things. You normally would need a big workup. Certainly it sounds like it's serious, so I wouldn't put anything off. I would get that immediately evaluated, either emergency department or a minor care.
Okay. Stomach cramping after a C-section, what could it be?
Sometimes after any type of abdominal surgery, you can get what we call an ileus, or a blockage of your bowels from what we call adhesions, which is scar tissue. So if that persists, certainly an x-ray, which we call a KUB, would be warranted, especially if you're throwing up a lot. Don't let those symptoms persist. Get that treated sooner.
Okay. This person says, my right shoulder is hurting. What can cause it to hurt so bad?
A lot of times just tendonitis and osteoarthritis, degenerative joint disease of the shoulder. Sometimes you can tear the rotator cuff. We try anti-inflammatory medicines. There's a topical medicine called Voltaren gel. You might need an MRI or even an orthopedic evaluation.
Geez, lots of things and lots of people hurting out there. Dr. Levine.
It's the wintertime.
Yes, it is.
We see it a lot.
Thank you so much.
All right.
We appreciate you stopping by. And as always, you can visit our website and see the answers to these and other medical questions posted online. And if you'd like to have Dr. Levine answer your medical question, you can always mail us at the address listed on your screen. Fax us 892-7305. Email us at laf@kfdm.com or post those questions every Monday on our KFDM News Facebook page.